Okay, so I'm just going to begin by introducing myself. So my name is Sancha Martin. I'm the Behavioural Research UK Leadership Hub Programme Manager, catchy title, I know, based at the University of Edinburgh. So I'm just going to run through a couple of points of housekeeping before handing over to Dr Sharon Cox, who's our chair today. So today's webinar will be recorded, and the recording and the slides will be made available publicly after the event. So it might be a week or so, but they will be available. The video feed and audio for participants is disabled so that you're not captured in that recording accidentally. The Q&A box that you'll be able to see on your screen will not be visible in the recording, but your name might be included if we ask your questions out loud. So if we read your question out, your name might be included then. So there is an option to submit questions anonymously today if you would prefer. So just a couple of points of order. So we're going to be around about 90 minutes today with a few minutes movement break around the middle. So maybe about 4 or 5 minutes just to stretch our legs. Please submit your questions via the Q&A box, as I mentioned, indicating who your question is for if possible. You can use the upvote function if someone's asked a question that you would particularly like to see answered. And then do note that the questions are visible to everyone on the call today. If you require closed captioning but you can't see this automatically, please click the CC box on your menu button and that should appear for you automatically. So if there's any issues, please pop a little note into the Q&A section if you have to. Do note that the translation varies on the speed of the speaker and the accent of the speaker, so we apologise in advance if there are any issues with that today. So I'm just going to hand you over to Sharon now, who's going to introduce the speakers and take us through the topics that we're going to cover. Over to you, Sharon.
Thank you, Sancha, and good morning, everyone, and thanks for attending this webinar. I think it's one of the most important ones that we've done. Of course, they're all important, but I think this is a really contemporary issue and something that is incredibly important and pressing right now. So thank you so much for taking the time out of your diaries to join us. So I'll be chairing today's session, and I'll be joined today by Dr Julze Alejandre, myself, Dr Niamh Hart, Sancha, who's just introduced herself, Professor Anne Phoenix, and Dr Lesley Uttley. And each of us today will be talking about a different piece of work within BR UK that is either seeking to develop our EDII strategy, or pieces of work, research work, which have particular elements of EDII within them. Next slide, please, Sancha. So today's topics, well, we're doing the introduction and welcome now. I'll go through BR UK, who are we and what have we done? We will talk about our definitions and intersectionality. So our EDI definitions and why we've got intersectionality, because some of you might be thinking, well, why EDII? We'll also be then presenting the findings of our rapid scoping review and case studies. And as I was saying, some specific examples of EDII and research there. We'll be talking about why research culture matters, some practical recommendations, because we often hear people say, this is all very well, I know it's important, but what can I do? And then we'll have time for a Q&A. So do put your questions in the questions and answer function, and we will come to those at the end. We'll try to answer as many as possible. Next slide. So the world today, well, I know I don't want to read off slides, but I think this says it really well, but there is an undeniable tension between what is happening politically in the world and how equality, diversity and inclusion initiatives are viewed. This is something that has come to the fore. Now, it's really important to say that whilst a lot of this is coming to the fore in some high income countries, some of these issues have never gone away in low and middle income countries, and we shouldn't ignore that. We also shouldn't ignore that science has a troubled past, littered with ethical and moral failures. And as a scientific community, it's important that we recognise that, drive forward, make change, but not forgetting our past. It's not only important that we move forward and do what's right, but actually, as I'll come to in some other slides, and we'll talk about throughout this webinar, not only not embracing EDII, not only is it wrong, actually doesn't make science as as the best that it can be. There are many examples in our history. One example, for example, is eugenics, that we shouldn't shy away from, but an appalling practice in medicine. But also we know that so many of our innovations, scientific innovations, have been designed for communities that are not representative of the either products or practices that will use them. So it's important to be inclusive, not just because it's the right thing, but because actually we want to provide science which is for everybody. We want to provide scientific outcomes that can benefit as many people as possible. And I've said before, and I'll say it again, science is open to everybody. That's regardless of the work that's done or who works within science. So today we will discuss why we believe that EDI can only ever be benefit to individuals, team, society, and the wider world. Next slide. So, we must defend science, social science and medicine from attacks on diversity. I'm often called woke or a lefty liberal, and I think these terms are often thrown around to shut down conversation, and we should fight back. We need to fight back. And I would say that for those people, myself probably included, sort of mid to late career researcher, we have a role to provide leadership here. So when we hear these terms, that EDII, well, it's nice to have, or we often hear these things like, oh, that's just woke, isn't it? Or one thing I hear often, because I'm somebody that talks quite a lot about the class divide within academia, is, well, it's a symptom of a larger problem. And while there may be some truth to these statements, that's not enough. It's not enough. And for those of us that are in positions now where we can make change, we should make change. I've had an interest in EDII for most of my career, but definitely for the last 10 years, which is about half of my career, so you know. And one of the things that I've noticed has not changed is EDII is still very much divided by those people who are interested in it and those who are not. And EDII really cannot be about people that are just interested in it in an academic level. It's something that we must embed within our practice, not just something that people are into. Next slide. So who are we and what are we doing at BR UK? So I'm Deputy Director of BR UK, and the directorship includes myself, Sancha, and the directors are, in case you don't know, Professors Linda Bald and Susan Mickey. Okay, so we are a consortium that is funded by the Economic and Social Research Council over 5 years. We're 18 months into that now. And what are we here to do? Well, we're here to harness, connect and extend the UK's existing capacity and capability in behavioural research and support the mobilisation of research into policy and practice. We aim to connect and engage a diverse set of partners from across academia, but also government, industry and civil society. So not just people that create research, but research users. We aim to do this by breaking down disciplinary boundaries to strengthen cross-sector engagement and co-create and promote a vision of behavioural research, which can drive the UK's research, behavioural research agenda forward. And as we do that, it's bold, we need to also be mindful and provide an inclusive environment for researchers at all career stages to thrive, which support the interdisciplinary and intersectoral engagement. So it's about harnessing the new generation of researchers so that there is already an appreciation of cross and transdisciplinary action, not something that people come to later in their career and think, oh, wouldn't it be good if we worked with so-and-so or with this sector, that we start to do that from day one. So our aims and methods, well, they're all here. I won't read them all out, but really it's about integration and coordination of people and skills, inclusiveness and collaboration between people, society, groups, and the public. And importantly, to embed research and to include people across all 4 nations. I'm sure you can hear from my accent, I'm from London and I love London. But another thing I've known in my career, I work in health, is that it's very London-centric. We need to get out of that. We need to not just be thinking, however, about England, but all 4 nations. Next slide. Next slide. Okay, thanks. Okay, so our vision for EDII, to create a research environment that values all colleagues in word and action and provides equitable opportunities for all to learn and to progress in their careers. And where policies, procedures and processes are accessible, clear, transparent and fair, and we'll talk about this. These can't just be words, we need to have actions, and we do have living documents. We have an EDII working group, which I'll come to, that can monitor this. Next slide. So the BR UK team, I've already said that we're a large consortium, so there's 8 universities, and then we have partners who are outside of academia. This is us. We do have information on our website as well that you can go to. And this is our team. So we have people at all stages of their career. Some people are still doing their PhD. Some people have now completed their PhD. And we have people that, well, I would say, completed their PhD a while ago. And then we have a very strong team of professional service staff who support us, but importantly are integrated into the decisions that we make and are very much integrated and part of our EDII vision. Next, please. So our EDI activity, so we have a working group. I'm one of the co-chairs of the working group with Sancha, who kicked off the webinar, and Professor Anne Phoenix, who will speak later. And our intention is to collaborate and share goals and practices, and to think about the documents that we create. Are they fit for purpose? Do they serve the community, both in BR UK and outside? Can we be an example for other research groups to come to and look at our policies and documents and think, this is a way that we can start? Because one of the things we hear, as I've said, is that people say this stuff is too hard, it's too difficult, I don't have time, and it's part of a bigger problem. So if we can provide some leadership, then we think that that's a good thing. We want to undertake critical engagement with others. That means working with other EDI groups in other consortium. And we are monitoring our own EDII characteristics annually to assess diversity over time. Now, we will be publishing those, and we'll also be seeking feedback from other groups. We don't want to mark our own homework, and we also report back to our funder. We want to develop research methods that are inclusive, and especially those which are inclusive of communities which are easy to ignore. And we want to ensure inclusion and engagement in activities with those from diverse backgrounds, especially those most affected by the issues being studied. And we want this to go beyond tokenism. We don't just want people to look at our, topic guides or to attend a couple of focus groups. We want communities to actually be part of the research that we do, and we'll talk about that. And we will produce an open access report outlining our goals, our progress and plans for the next 12 months, because as well as being, trying to be leaders here, you can only be leaders if you're open to the progress that you're making. Next slide. So here we are, here's the working group. If you have questions for any of us or as a group, you can ask here, but also if you want to contact people individually, then here we are. That is me, I've just dyed my hair. Okay, BR UK guidance. So we have these documents on our website, and as I said, they're open access, they're available. Please do look at them, please provide feedback, but also if you're working in a group that you think, we could be doing better at this, take a look. We don't all need to reinvent the wheel here. Some of these things we've taken from our own from other groups, groups that we've worked with, but we've altered them for what we're doing here. There are some really good working documents available freely online, and it's okay to use them, obviously with credit. So we have these different documents here. We have our position statement. We have our inclusive communication guide. We also have a wellbeing document that's currently an internal document. Next slide. Okay, so now I'm going to hand over to Professor Anne Phoenix, who's going to talk a little bit more about our EDII definitions and how we come to them and what they mean. Thank you.
Thank you, Sharon. And hello, everybody. And next slide, please. What I want to do is to just go over some definitions so that you know how we're thinking about the issues of equalities, diversity and inclusion, but also so that you can see how we're thinking about intersectionality and why we've added that to the EDI. So first of all, then, in terms of equalities, it's quite simply making sure that we have equal access to resources and opportunities for all individuals and all groups within BRUK, so that we provide and that people can actually feel that they're being given equal access. But on top of that, as you'll see in a moment, we also want to try to ensure that we're thinking about equal outcomes as well. So equity, and I'll say a bit about that in a moment. And then diversity. It's absolutely clear, and there's quite a lot of research that shows that having diverse people involved in research, in companies and so on, actually improves what it is that people are able to deliver. So we want to ensure that we have a diverse range of people from different backgrounds. But when we're coming to thinking about research, we also need to think about diverse research approaches that will include different groups of people and reflect wider society. So inclusion is important. These three terms are interlinked. And in terms of inclusion, we want to make sure that we welcome and treat everybody equally, and that we do so from people from a range of different backgrounds, whether those are racialized, gendered, Sharon's already mentioned social class, and different parts of the UK and so on. We want to make sure that we are treating people equally and welcoming everybody, regardless of background. And when we're thinking about our colleagues, we want to ensure that we give them all equal opportunities and that we have a range of people included in. That means that we have to think about belonging. For BRUK really to work, we need to make sure that everybody feels that they belong to the research group and the programs that we're doing. So we want to make sure, and we hope that the things we've done already go some way to make sure that we are providing an environment where people feel that they're supported and that they can work towards their goals. And the point about that is that one of the things that BRUK is designed to do is to create a step change to innovative and impactful behavioural research. And we can't do that without equalities, diversity, inclusion. And we would also argue intersectionality, which I'd like to talk a bit about now. So intersectionality is a term that sometimes divides people, partly because I think often people don't know what is meant by it and feel that it's just an add-on. But it's not, because it simply recognizes that all of us belong simultaneously to different social groups. So all the things that I've mentioned in terms of racialization, in terms of gender, social class, place, and so on, sexuality, disabilities, they all are categories in which we're positioned differently, of course, but we're all positioned within those categories simultaneously. And we can't understand social identities or what's happening with people or how we can treat people equally, include them and so on, without thinking about how the particular groups of characteristics that we're interested in intersect for particular people. So we have to analyze and understand basically the ways in which everybody is multiply positioned. Nobody is only gendered. they are also racialized, classed, and so on. So we also have included the notion of equity. And equity is not just equality, but it's about trying to understand how we can make things genuinely more equal for people, not just individually, but in terms of what society needs to provide, what a research project needs to provide in order to be fair, to promote justice and equal entitlements and rights. And I'm going to give some examples of that in a moment. So first of all, thinking about what is intersectionality and saying a little bit more about it. A term that's been coined since 1989, but something that many people were struggling to include in their research long before Kimberlé Crenshaw coined the term. And as I've said, it's recognizing that everybody is simultaneously positioned in multiple social categories. And one of the things about that is not that you can simply add together different categories and say, for example, that given that many people have recently watched the Netflix Adolescents, it's not, we can't say that being an adolescent boy means that somebody is doubly oppressed or doubly sort of disadvantaged. We have to think about the ways in which gender and age and other categories actually mutually constitute each other. And I think Patricia Hill Collins, who's done a lot of work on intersectionality, puts this well when she says, the term intersectionality references the critical insight that race, class, gender, sexuality, ethnicity, nation, ability, and age operate not as unitary, mutually exclusive entities, but rather as reciprocally constructing phenomena. Okay, so that makes for people having particular circumstances that make it necessary to understand those when we're trying to think about equality and equity. Next slide, please. And Olena Hankiewski also, I think, helps us to understand, as she says in Intersectionality 101, put simply, according to an intersectionality perspective, inequities are never the result of single distinct factors. Rather, they are the outcome of intersections of different social locations, power relations, and experiences. And what it means is that, for example, somebody who is a woman cannot assume that they're speaking for all women equally. Somebody Black will have different experiences because of the distinct combination of categories in which they're located in particular ways. Next slide, please. And it means that if we're to think about intersectionality, we also need to think about structures. And it affects our research because if we don't recognize differences within the groups that we're focusing on, we miss the fact that there are commonalities across groups. Groups are not essentialized into all one pattern. We have to see that there are some people who will share things with other groups, quite different groups, for whatever it is that we're interested in, but that means that there'll also be intra-group differences within the group. So intergroup commonalities, intra-group differences, as well as things that we can say about particular groups. And it means that we have to think about which differences make a difference when we're particular. We can't assume that we'll know the essence of difference. We have to think quite hard about it. And when we're thinking about, as colleagues working together in a big research program or anything else, we need to think about, how it is that quite often in companies, for example, it's easy to reproduce the same kind of person in an institution. In other words, we have to think about multiple positioning in recruitment and make sure that when we're thinking about equalities, we reflect that. And it means that we have to welcome and treat people equally from all sorts of backgrounds and recognise that they are multiply positioned. So we can't take for granted what it is that will affect their performance in a particular organisation. And it means that we have to respect people and value them as individuals while also recognising that we need to be supportive of the groups to which people belong. And it means that, as I've said already, that we need to provide environments where people can feel that they can work towards their goals, they can say things that may be different from what some other people are saying and still feel supported and have those ideas respected and thought through. Next slide, please. So I wanted to say a little bit about the differences between equality and equity, because equality is what's usually included in EDI or in the States, DEI policies. So equality does something that I've just talked about, which is focus on sameness without recognizing that actually sameness is not necessarily fairness, and equity focuses on fairness and how we get to fairness rather than assuming that everybody will be the same within a particular group and we treat them all the same. And if we're talking about resource allocation, we are talking in terms of equality about distributing resources evenly across groups, giving each group the same. Whereas equity does not do that necessarily. It recognizes that different groups, different combinations of group might need different amounts of resources in order to have their needs fulfilled, in order for things really to be fair. Again, outcome aims in equality is to do with equal treatment, whereas equity, it's equal outcomes, which will not, as I've just said, require equal treatment, but thought about treatment. And with equality, we're often focusing on individuals or groups which we frequently treat as individuals, whereas with equity, we don't forget that, but we also have to think about socio-structural processes and systems. And I want to give some examples now with a few more slides on that. First of all, thinking about the way in which, if we are to really fit with what the current government says, that it's a mission-led government and they're concerned with milestones, we need to break down barriers to opportunity. And here is a representation of the difference between equality and equity. Here we have two generations and as far as we can see, two genders. And we have people picking fruit. Now, if we give everybody the same stepladder, you can see that not everybody will be able to pick the same amount of fruit. In other words, we need ladders of different sizes in order to really be equitable, to allow people to have genuinely equal chances. The same goes here. If we give everybody the same kind of vehicle, mostly bicycle here, then we're not actually treating them equitably because people are different heights, they are able to use their legs in different ways, and they need something different. So the second one with wheelchairs is provided by the Scout Association last year. And here, thinking about justice as well, it's not only that we need to progress towards giving ladders of different sizes, but we might need, in picking fruit, to also shore up the tree so that there are equal amounts of fruit that are accessible to everybody. So justice requires actually changing the structures and the social context as well. Next slide, please. Okay, we're going to move on now to thinking about the scoping review. So Julze Alejandre and Niamh Hart are going to present this. Thank you.
Thanks, Anne. Good morning, everyone. My name is Julze Alejandre. I'm a research fellow in public engagement at BR UK here at University of Edinburgh. And today I'm going to share findings of our rapid scoping review that explored the scope of applying EDII principles in UK's behavioural research landscape. I would like to acknowledge the contributions of my colleagues at BR UK into this review. Next slide, please. So this would be the outline of my presentation for today. I'm going to talk about very briefly the background and the objectives of our review and some relevant findings, and then a summary of key findings for the conclusion. And I'm going to pass on to Niamh to highlight a case study that we've selected from the breadth of different studies that we included in our review that we think captures or embraces some of the EDII principles that Anne discussed a while ago. Next slide, please. So I think I'd like to start by saying that behavioral research evidence is very essential in informing policy and interventions for various societal challenges such as climate change, health and well-being, building resilient communities, as well as national and local economic development. And the generation of good quality, robust, and collective knowledge from behavioral research actually requires the inclusion of diverse voices from various population groups, which could be achieved when the principles of equality, diversity, inclusion, and intersectionality are meaningfully embedded or integrated in the research design. However, the scope on the application of these principles in UK's behavioral research landscape is currently unknown, specifically its purpose, its targeted population groups, the methods that were used, as well as the strengths and the weaknesses in applying such principles. So hence we conducted this scoping review to investigate this gap. Next slide, please. So for this review, we aim to map what EDII principles are applied in behavioral research in the UK in the areas of environmental sustainability, health and well-being, resilient communities, and economic development. We also synthesize identified strengths and weaknesses on the application of EDII principles in UK's behavioral research landscape. Next slide, please. So for this review, we considered 3 sources of record, such as databases of scientific articles, such as Web of Science and Scopus, government websites, such as website of UK, Scottish, Welsh governments, as well as Northern Ireland Executive. We also considered websites of UK funding organizations that usually fund behavioral research projects. Next slide, please. We then used this inclusion criteria in selecting the studies for this review. So we considered records or studies as behavioral research if it involves factors or conditions or exposures to interventions that aim to change behaviors. We also included studies that focus on BR UK research themes, such as on environment, health, resilient communities, and economic development. We also use the definitions of EDII principles that were shared by Anne a while ago. And finally, we only included scientific articles, reports, policy, and consultation papers that were published between 2014 and 2024 by UK and devolved governments and funding organizations that are based in the UK. Next slide. So in total, we had 7,655 records, which underwent rapid and proportionate double screening. So in the end, we included 307 studies after full text screening, and the data from this 307 studies were subjected to proportionate double extraction and data charting process, and then analysis and synthesis. Next slide. Just to show you the different types of literature that we included in the review. So we included a huge number of reports from government and funding organizations, and these are followed by scientific articles. Next slide, please. This slide also shows that in terms of the intersection of behavioral research and the application of EDII principles, most studies that we included in our review focus on, for example, studies that talks about development or improvement of health promoting behaviors, studies that focus on climate crisis, child safety, and mental health. And there were also a few studies that focus on interventions to change behaviors of consumers, housing interventions, as well as studies that focus on physical health. Next slide. We also mapped out the profile of individuals who are commonly engaged or involved in behavioral research, and we categorize them as follows. We categorize individuals such as service users and minoritized groups such as members of the public, people with lived experiences, users of public services, and members of minoritized groups. There are also a category of individuals that we categorize as service-oriented groups or stakeholder groups, such as service providers, for example, teachers, social workers, volunteer workers, laborers, and business owners. And lastly, we have a group of individuals whom we categorize as expert groups, such as scientists, government professionals, and representatives of civil society organizations. Next slide. So now I'm going to talk about what are the gaps, what we've seen so far on the application of EDII principles in behavioral research based on the studies that we included in our review. So first gap that I want to talk about is there's insufficient representation of my marginalized group and diverse groups. I would like to say that there is still underrepresentation of ethnic minority groups and groups who belong to multiple minority groups or who position themselves in certain points in that intersection that Anne mentioned a while ago. And this make research remains heavily focused on or accessible to and geographically confined to populations that we call as Western educated, industrialized, rich, and democratic populations. And this restricts socio-demographic diversity in the research populations that we're including in behavioral research. Next gap that I want to talk about is there's limited consideration of participants' intersectional identities. Basically, there is a superficial and fragmented approach to diversity, and this is associated with a failure to consider the interplay between ethnicity, gender, age, socioeconomic status, and focusing only on one single sector, for example, and this results to the reduction of the complex live experience of different population groups that we were investigating in, and limited transferability of findings in other sectoral groups and other contexts as well. So next gap is on the structural barriers to inclusive, equitable, and sustainable participation. So aside from the time and financial constraints that restrict the participation of marginalized groups, this also includes the utilization of participant selection criteria that often exclude individuals based on their perceived capacity to engage or be involved in the research that reinforce systemic inequalities and result to disempowerment and eroding trust among marginalized groups. So we usually only include individuals that we think has the capacity to be engaged with or participate in our research. Next gap is on the structural and methodological limitations. So there's limited strategy or effort to extend research beyond dominant geographic and cultural context to reach out to groups who have different experiences or perspectives about the research topic that we are investigating. And lastly, there's limited transparency in reporting intersectionality or intersectional and diverse composition of research participants, particularly since traditional research methodologies do not explicitly incorporate EDII principles, and this leads to bias in study designs and analysis, and there is an underreporting of ethnic composition and intersectional identities of research participants, making it very difficult to assess diversity, inclusivity, and the intersectionality in our research. Next slide, please. So in summary, I would like to say that there is an increasing appreciation on the intentional integration of EDII principles in research design, particularly equality, diversity, and inclusion based on the scoping review. And whilst intersectionality is recognized, it is still not well reported in behavioral research. And behavioral research also struggles with limited public representation and intersectionality and sustained engagement and other structural barriers to participation in behavioral research. And our findings highlights, and I would like to say that our finding highlights the need for intentional methodological shift in order to embed and report this very important principles in behavioral research. And now I would like to pass on to Niamh to talk about a case study that we would like to highlight from our scoping review.
Thanks, Julze. Hi everyone, I'm Niamh Hart, a BRUK Research Fellow based at Edinburgh, and I'll be describing one of the case studies that were included in this scoping review, which explores communication about sexual orientation and gender between clinicians, LGBT+, people facing serious illness, and their significant others. Next slide, please. So in the rest of this presentation, I will be referring to the term LGBT+, which refers to lesbian, gay, bisexual, and or transgender people, and anyone who considers themselves to have a minority sexual orientation, gender identity, or gender history. And for background, 8% of adults have a minority sexual orientation, and 1% identify as trans or non-binary. And despite advancements in LGBT+ legal protections, discrimination in healthcare leads to delayed care and poorer health outcomes. Poor communication and assumptions made by clinicians about patients' gender and sexual orientation can undermine clinical relationships, leading to disengagement and loss of trust. So to improve LGBT+ inclusive communication and care, it is vital to understand the challenges, preferences, and potential benefits for key stakeholders. And this study aimed to do exactly that, alongside identifying best practices for inclusive clinical communication. Next slide, please. So the authors used a qualitative interview design with participants as self-identified LGBT+ patients presenting with a serious illness. Their significant others were unpaid caregivers and included friends and families, and clinicians were either NHS doctors, nurses, or social workers in serious illness care. Reflexive thematic analysis was used to analyse the data with LGBT+ PPI members, recognising that standpoints shape interpretations. Next slide, please. A total of 74 interviews were conducted and 3 main themes were generated, such as creating positive first impressions and building rapport, enhancing care by actively exploring and explaining the relevance of sexual orientation and gender identity, and visible and consistent LGBT+ inclusiveness in care systems. Next slide, please. So these findings demonstrate that inclusive discussions about identities and relationships in an appropriate environment with explanation of relevance to care may assist clinicians in delivering appropriate person-centered care. Formal training, inclusive assessment and monitoring systems, appropriate policies and visible demonstrations of inclusivity are central to this. So whilst social, cultural and religious backgrounds can influence willingness to initiate and engage in discussions about identities and relationships, avoidance of these discussions may risk compounding existing intersectional qualities. From these findings, 10 recommendations for clinical communication were developed to improve health equality and equity policy. For example, the use of neutral language, such as neutral pronouns, using words patients use to describe themselves and their significant others, and creating a safe space by making questions about orientation and gender relevant to care. Next slide, please. So in terms of the study's strength, it was a large qualitative study utilising diverse perspectives from stakeholders with lived experience. It focused on serious illness, highlighting needs during critical care moments with a person-centred approach, and the study methodology was EDII informed, recognising intersectionality. And actionable recommendations were developed. However, the majority of patients and participants were from Greater London, which has comparatively large LGBT+ populations. In terms of intersectionalities, the authors only considered ethnicity, and the sample therefore cannot describe the breadth of LGBT+ experience. And lastly, there is now a need for implementation research to understand the effectiveness of recommendations. Next slide, please. So to conclude, inclusive person-centered healthcare requires appropriate and tailored communication between service users and clinicians, and organizational structures to support those interactions. Future research directions should include the development of EDII strategies for rural and less urban healthcare settings and an evaluation of inclusive communication effectiveness. Thank you for letting me share this case study from our scoping review. I'm going to now pass it on to Lesley.
Hello everyone and welcome back. My name is Lesley Uttley and I am a Senior Research Fellow at the University of Sheffield, and I'd like to make some space today to talk about research culture, thinking about what it is, what it can relate to, And I'd like to use some observations from my own work to maybe think about the impacts of research culture on the evidence that we produce, and talk about some empirical work that I did in this field. Let's preface this by just saying that the majority of researchers are doing their absolute best in the situation that they're in. But I just want to acknowledge some of the unspoken norms and values that govern research culture. So in 2020, the Wellcome Trust asked 4,000 researchers to name the 3 words that come to mind when they think about research culture. And the words that come to mind on the left are fairly pressurized, competitive, in some cases collaborative. But when you ask people what they wish research culture was like ideally, then they tend to centre around being more supportive and creative and fair and secure. And this may resonate with you because ultimately researchers, whilst doing their best, may not always be acting directly in the pursuit of ultimate truth. Research is a career, and it's not a particularly stable one. And there's certain things that you have to do in order to stay in the research career track. So my goal is to show you how research culture and research integrity are quite interlinked, and think about how this is maybe impacting the evidence ecosystem, and how it influences the research that we produce in terms of how we conduct it, how we publish and share it, and how research is prioritised. Next slide, please. So the majority of my time is spent on a fellowship, which is examining the research integrity of systematic reviews. So I'm in a fairly privileged position that I have some independence to be able to amplify this conversation. But systematic reviews are a really good litmus test of the evidence base because they are the pinnacle of the evidence base, and we expect them to be done in a very rigorous way. We have very high expectations of their conduct. So my fellowship is a living review, and it's gathering together research papers and sometimes editorials which point out where published systematic reviews have not been done well. And the aim of this initiative is to help researchers, peer reviewers, editors and publishers to understand what to look out for when they are appraising the quality and contribution of systematic reviews. Next slide, please. So the finding in my work is basically in its first version found 485 different papers highlighting problems with systematic reviews, and there's 67 different ways you can do a systematic review less than ideally. And think about that. So there's so many papers highlighting problems. They're at the pinnacle of the evidence space. They are the creme de la creme of scientific methods, and we rely on them being objective and dispassionate and able to give us a completely comprehensive and unbiased view of the evidence base. Next slide, please. So as a living review, I found that in the next iteration, it brought the total number of papers up to 637. And I had to sift through about 8,000 citations. And there were about 2,000 relevant papers. So what it was showing me was there was a lot of potentially relevant papers, but they'll get excluded if they're not talking about systematic reviews. Maybe they're talking about rapid reviews or just literature reviews in general. But it's really showing an absolute influx of this type of paper, and they're often unoriginal. They're not aware of other papers in this field, and they're just completely uncontextualized, just showing that not only are systematic reviews flawed, but generally the evidence base is poor in terms of the evidence that's critiquing systematic reviews. And so I wanted to flag that this type of paper tends to come from certain parts of the world, the global north and west, and they are often very banal research contributions. Next slide, please. In other work, there's evidence that meta-research papers often outpace primary research in many areas. This is another sort of worrying trend. We don't need any ethical approval to do a systematic review or a meta-analysis, so they are quite an easy paper to churn out and publish. So next slide, please. But some papers do highlight very interesting trends in what's happening in not only systematic reviews, but the evidence base generally. And there are now a few studies that are looking at, well, who is conducting systematic reviews? And what we find is that teams of authors are often not diverse. They are panels of people with the same characteristics, and as such, unlikely to represent diverse groups. Next slide, please. So what's happening? Let's recap. We've got a lot of papers indicating that the gold standard of evidence is often falling short of what's expected. We've got a heck of a lot of papers highlighting really often completely unextraordinary trends in systematic reviews. Sometimes they're insightful, sometimes they're not. And these papers are often coming from the same geographic locations, often from the same institutions, and very often the same authors. In fact, some authors are prolific in this field. So could it be that the fact that we need to publish in order to stay in this career is perhaps contributing to this influx of very uninteresting research, which could be described as research waste? Next slide, please. So just in order to think about research culture a little bit more empirically, I decided to do a rapid scoping review of research culture, and I invited authors from a diverse network who were publishing in the field of research culture. It was important to be able to really think carefully about the different terms which literature could be included for this, because often these relevant papers are not calling it research culture. So we did comprehensive literature searches, thinking about the terminology, and we also asked authors if they were aware of any other similar papers or related papers that could feed into it. Next slide, please. So we found almost 800 papers that were relevant, and I coded them thematically. As a scoping review, I couldn't do a detailed analysis of full text, so I was looking at the overall messages of the paper. And generally, the themes fall into these 4 domains that characterize research culture and also research integrity. We expect research to be inclusive of the entire population, and not just to get the low-hanging fruit, the participants that are easy to recruit. And we also expect teams of researchers to be diverse and not just people of the same characteristics. We expect research to be done and reported in a way that would enable somebody else to replicate and repeat it and hopefully come up with the same findings. We expect research to be done according to best practice methods that are available, and that uses the right level of expertise in conducting it. And we expect researchers to come to a research project with clean hands, conflicts of interest declared, and with their motives for doing the research acknowledged and that positionality considered. Next slide, please. So like I said, I couldn't do a detailed analysis of full text, but what I was trying to do was to synthesize the findings in a way that wasn't just vast swathes of text or very long tables. And instead, I did a narrative storyboard synthesis, which tries to gather together all these themes and trends into these diagrams that help us to quickly understand how some of these trends are related. And I would direct you to the paper to look at it in full, because we've only got 10 minutes today. I'm going to focus in on the inclusive diagram. Next slide, please. And it's called Layers of Privilege in the Ivory Tower of Academia. And what it alludes to is the fact that a lack of diversity starts pretty early. Even university students are not particularly representative of the entire population, but at every level of further educational qualification and every layer of recruitment, diversity drops off. And academia is a sector where it's often about who you know, and cronyism and nepotism can infiltrate recruitment processes. And there's a level of status bias where prestigious universities are favoured when it comes to recruitment. And then this kind of elitism operates on a global scale as well, and high-income countries can dominate research prioritization, and there's often a lack of meaningful engagement when it comes to global collaborations, whereby authorship parasitism, where high-income country authors can dominate the prominent authorial positions on papers, occurs. So doing research on people instead of with them. Now, the currency in academia is papers. That's the way that we get promoted and the way that we can stick around in this career. And the people who govern what gets published, the editors, are often panels of people, and it's not a particularly transparent process for how these appointments are made, and those are quite powerful roles, and also editorial boards of journals. This lack of opacity also extends to senior university management structures, and they have important powers which determine who is promoted, who is given leadership roles, and these are quite critical decisions. And when you have these panels of people who are not diverse, they can uphold researchers which have benefited from all these layers of privilege and have been able to accrue the publications and the funding grants because they are in the majority and they haven't had substantial disadvantage. Next slide, please. So I made a series of recommendations based on all of the findings in order to improve research culture. I'm not going to read them out. I've highlighted some in bold that relate to inclusion, and I would direct you to go to that. I would focus just on 2 points here. And if you want to address research culture, I would recommend that when you come to recruitment or thinking about PhD students, you look for someone not necessarily that's going to fit in with your team. This is something that happens. Look for somebody different, somebody that's going to give you a different perspective, who's going to challenge you on certain things. And also when it comes to EDI, don't just delegate that to somebody who is minoritized or a junior member of staff. I would like to see senior leadership leading with EDI, not leaving it as a postscript for somebody else to think about. That's it from me. So I think I'm going to pass back to Sancha.
Thank you, Lesley. So I'm just got 3 slides here just to go over some practical considerations. So some of the things that we've learned over the last year in setting up our EDII approaches within our project operations, within our team, and within our research. So when it comes to project operations, so the governance and the day-to-day running of your projects, the first thing I'm going to say as a project manager, this will unsurprise you, wherever possible, if you're applying for funding, check the fine print to see if you can claim EDII costs within that. So any support that you can obtain from your funder for things like inclusion funds that could cover, for example, child support costs for people attending meetings, It's really important to get that funding in there if you can. I think at the end of the day, EDII comes down to, in my mind, treat people how you would like to be treated ultimately. So respect individuals, respect your colleagues, those that are working with you, your research participants. Maintain confidentiality across the board wherever possible, and make sure you're complying with the local legislation in whatever country that you're in. We recommend establishing a working group so that they are specifically targeting the EDII approaches to make sure that they are discussed and they're implemented in an appropriate way. But once you've established your working group, don't just forget about it. Don't just write it up and then put it on a shelf. Make time to talk about EDII throughout your teams with your advisory boards, your collaborators, and those that are using your research. If you write down your expectations as a team and how you're going to behave and approach your EDII principles, you're more likely to get buy-in and a policy that represents everyone's opinions. Of course, you'll never make everyone happy, but it is important that you have those discussions. You can carry out EDII surveys, so collect some characteristic data so that you can shape your team and see where you have gaps across your team, your project, and your research functions. Most importantly, learn from others. Never assume you know it all. Make sure that you speak to those that are working in your sectors in similar projects, but also those working outside your sectors. People will do things in different ways. They'll do things that you've not thought about. So always be open to that conversation. Within your team, this is reiterating a lot of what Lesley's just said, make sure that you recruit a diverse team, so bring those various different perspectives and challenges to your group. Make sure you advertise widely, so not just in your usual place of adverts. Consider gaps and where you're potentially not reaching out, and make sure you can push as far as possible. One thing to consider is blinding applications so that you remove unconscious bias. We also encourage setting EDII goals as part of your personal development plans within your team, and to provide mentoring structures where possible to help people think about EDII within their career and where they could do better. Recognise and avoid clashes with key cultural events and celebrations. So we've come up with the very snappily titled EDII calendar within BRUK. If anyone's got a better name for that, do let me know. But we've come up with this calendar that lists all of the local public holidays, religious holidays, everything that we could think of. So anything where someone may have to travel away from home to attend a workshop, for example, if it clashes on that calendar, we try and avoid that so that we're not taking people away from important life events for them. The obvious things, Sharon mentioned that we have a wellbeing document, but we talk about making sure that people, we set meetings within our core working hours, and we avoid encouraging staff to overwork their hours. So revise your approaches regularly, invite comment and feedback, and identify any training opportunities. So in universities, we kind of take for granted that there is EDII training available, but that's not the case across all sectors. BRUK is developing some training plans that we will be launching in 2026 to support teams with EDII and public engagement and stakeholder involvement. So my last slide here is just about EDII within your research. So again, kind of reiterating a lot of the things that we've touched upon, making sure you've encouraged those diverse perspectives and feedback on the methods from the beginning of your project. Make sure you're representative of the population that you're talking to. Think about any methodological biases that might exist and how you could address them. And if you don't know how to address them, how are you going to acknowledge them at least? Use inclusive questions that reflect the needs and experiences of the individuals. Use a wide range of platforms again to identify and recruit your research participants. Most importantly, in a way, once you've done your research and you have your findings, make sure that you can communicate them in an accessible way so that people can understand them. And then solicit feedback on how useful those findings were, both to the people involved, to the people affected by it, and to policymakers, for example. So I'm going to hand on to Anne now, who's going to wrap us up with a quick summary, and then we'll move on to our Q&A section. Anne, over to you.
Thank you. And I just wanted to point out that last Monday, Independent Sage published a paper designed to tell us about why EDII is so important for behavioural research and for affecting behaviour. And I think that they put it so well. And of course, you can look that the paper's freely available in on the Independent Sage website, and there's a link in the next slide, so you can look at it yourself. But I think these points are just what we've been trying to say. So if we genuinely want to improve creativity and innovation, then we do need to have diversity, because diversity, as is shown in much research, actually does fuel innovation, because people have different viewpoints if they come from diverse perspectives, and that really helps. And it also helps to challenge conventional thinking and encourage creative solutions, which, if we're interested in changing behavior, reaffirming some behaviors, we really need to think about how we can do that differently. It also helps us to enhance problem-solving ability, because the alternatives that come up when you've got different groups of people really help us to make better decisions, and to also think more broadly than simply the local. In other words, if there's diverse populations, we're more likely to think about global challenges and the possible solutions to those. And we know for certain aspects of behavior, like thinking, for example, about the pandemic and vaccinations and so on, that we need diverse views that get us to dealing with global challenges in ways that address disparities, that ask research questions that will help us to do that. And it also means that we think about research design. I mean, so frequently in the past, and still, as we've seen from the presentations we've had today, for example, from Julze and Niamh, and also from Lesley, that there is no diverse participant recruitment for various bits of research, and no diversity in the researchers. And therefore, the scientific validity of what's being done is questionable, because it's not covering a diverse range of understandings and positionings. So in order to have genuine societal impact and equitable outcomes, we need to make sure we have diversity in research design. And it means that we also fit in with, for example, the Office for National Statistics, which, from its Inclusive Data Task Force, which reported a couple of years ago, actually recognizes that we have to stop thinking about some populations as hard to reach, and instead recognize that those populations are easily ignored, but have to be included. And all of that is important for reducing bias and discrimination, and therefore increasing trust in science. And that trust is really important, because unless different groups trust the research findings, they won't necessarily change their behavior or accept or engage with scientific developments that we want them to. Next slide, please. So just to finish off, this is the Independent Sage paper that they published last Monday. And as they say here, that we need to stand up to attacks on DEI, that's in the States, and obviously for us, it's EDII. As they say, we believe it so strongly, we've come out of retirement to do so with a new 3-page report. So I hope that you will read that contribution in how to make diversity, how diversity makes better science. And that is something that we certainly believe and are committed to in BRUK. Thank you.
Brilliant. Thank you all, and thanks to our speakers. I hope people are feeling inspired. We have a few questions in the Q&A, and I've been sent some through as well. So if we look at the Q&A now, I think Jules, sorry, I can't speak today, Jules, we have a question here for you. How would you suggest reporting intersectional identities whilst also minimising the risk of identification and jeopardising anonymous research participation? Or any general thoughts on the balance between reporting intersectionality in balance with risk of identification?
Yeah, thank you. That's a very loaded question, but thank you for asking. It's very also important question. My answer that I'm going to share with you is based on the practices that we've seen in the scoping review, but also some practices that I applied in my own PhD research, for example. So to report intersectionality without compromising anonymity, first, if there's an opportunity or we think we can aggregate data into broader categories, that's like one practice that we're usually doing it already. So like, for example, we're categorizing data based on age ranges and ethnic groupings, for example. So that's one practice. The other one is using composite description that reflects the intersecting identities of our research participants, for example, if that is possible. So for example, using composite descriptions such as middle-aged, Black, disabled woman. So that's like you're already highlighting the different intersectionalities of that research participant without particularly without compromising their anonymity. And then another practice is avoiding the use of unique combinations of characteristics when the sample size is very small and or when you think the participants are in a context that's very identifiable. So there are instances that we cannot use those kind of combination if we think like we have very small participants or like the context where research has been conducted is in a very identifiable context. And the last practice is using group narratives, for example, or pseudonymizing or using pseudonymized vignettes, for example. So those are some practices that we've seen in the scoping review, but like some practices that I've also done in my own PhD research. But I think if Anne or Lesley or Niamh have some practices or some things that they want to share, I'm sure they have. They also conducted applied some of these practices or like some practices I haven't mentioned probably. So those are my questions, answers to the question. Thank you.
Thank you. Just before I come to any of the other panelists, in case they do have answers, for those of you that aren't aware, we have a webinar series, and I think it was our last webinar, but it is available. Maybe we could share the link. We ran a webinar on open science for qualitative research that sort of hits on some of these points as well, especially in qualitative research where there are small samples or groups which have been easy to ignore in research. Some characteristics can be extremely identifiable and nonetheless reviewers ask for them. I've just been through this process myself. So one of our speakers did actually present a framework for making that data kind of available, but de-anonymizing it as well. So we can make the most of all of the data that we have available, but also whilst not compromising people's identity. So if we could share that link, that would be great. Does anybody else have anything to add? Thanks, Jules. No? Okay, then I'll come to the next question. Anne Phoenix and other speakers, how would you best define the intersectionality of ethnicity, race, and socioeconomic status factors? Also, what factors would you consider in defining this intersectionality?
Thank you. And it's a very important question, and partly important because frequently ethnicity, racialization, and social class really do decenter each other. So what I mean by that is that when I've said already that one cannot in any group take an essentialist approach, assume that everybody within the group, say for example, of Black people, that they're all the same, we have to think about the ways in which social class does decenter. And by that I mean changes how people are positioned, the treatment they receive, how they feel, their identities, and so on. And we have to take that into account. Now, social class, as I'm sure that many people know, is not a protected characteristic under UK Equalities Act. But at the same time, it's really important. So, for example, some of the things that are central to understanding what happens to Black people, Asian groups, and so on, it's to do with education, for example, and outcomes, is very much differentiated by social class, which doesn't mean that racialization and ethnicization don't also matter, but it means that we cannot treat people as all the same. And not only that, but generation matters, because different generations also have different experiences of all sorts of things. And also the place from which parents, grandparents, oneself comes also has an impact. So frequently, the categories that we use are blunt. So if we're thinking about Black, white, and Asian, that, as many people have pointed out, in many, many contexts, they don't really help us to understand the niceties, the particularities of what's happening with people. So Asian, for example, there are vast differences between Indian, Pakistani, and Bangladeshi groups that are dynamic. They change over time as well. And we have to really think about how gender, class, and so on intersect with those things, so that we understand that Bangladeshi origin children, for example, who always used to do the worst at school, are now doing better than many other groups, certainly than many white groups. And that, you know, that's thinking about the fact that many are more likely to be working class than others. So we have to think about social class and ethnicity, and recognize that some people use, for example, not ethnicity and race per se, but racialization, ethnicization, minoritized ethnic groups, to give a real understanding that that's how we're currently defining things. We're doing the defining rather than groups having an essential characteristic that's fixed for all time. And I think that we also need to recognize in that when we're doing analyses, that, for example, on the census, the Office for National Statistics census, that what was called the ethnic question, first of all, was first asked about in 1991. And then it's been different at every single census, because there's lots of argument about how people want to be defined, what their identities are, which groups should be included, how much they should be defined, and so on. So in 2001, for the first time, there was the mixed question, which, you know, sort of before that, people with mixed Black, white, Asian, white parentage were just expected to put down Black or Asian, and so on. So we have to understand that one of the reasons that intersectionality is so important is it keeps us aware of both dynamism and essentializing of categories that are not essentialist at all. And so we need to, I forgot what the second part of the question was. What factors would one consider? Well, we have to also think, as I've said before, about gender, about age and generation, and so on and so forth. We have to address complexity, unfortunately. I mean, it would be nice if things were so simple as being able to say somebody Black is X. But we know that a huge difference that's emerged in the British context, for example, as those with more directly African origin in Britain grow, is that there are huge differences between Caribbeans, people with Caribbean origin, Nigerian origin, and so on and so forth. We have to take an intersectional view if we are to have an equitable sort of way of addressing behaviour, for example.
Thank you, Anne. I have a question. Maybe this is for Lesley or Niamh or Julze. And I also have a question for Sancha. So I'll ask both questions. This has come from actually a UKRI leadership course that I've been on, where we've been talking about these issues there as well. And this leadership course includes people who are running major UKRI funding programs. So there's a lot of thought going on about this, but it'd be good to share some of it. One of the things is, how do we incentivize people to do this? This is an age-old question, I know, but what people have got away with, and I've done this, so I'm going to say I've done this because this is how I was trained, that you just sort of get to your conclusions of your research paper or your discussion, and then you say, oh, well, there's all these limitations, one of which is that it's not representative. And that's how we've sort of got away with it, because you've acknowledged it, but you haven't really done anything about it. So how do we incentivize it, and how do we stop that as a practice? And I guess that comes from more leadership from funders, maybe, I don't know. And another question I have, which has been a main focus point actually of this leadership course, is about cross-mentoring and thinking about the research environment that we work within. So we've spoken a lot about research, but Sancha, a question for you is, as someone who's not a researcher but works within that research environment, what can we do to be more inclusive to people that are not necessarily doing research but nonetheless are supporting the research? So there's two questions there that I'll leave you as a group to answer.
I'll just jump in on your first point about how to make sure that EDI and inclusion just isn't left at the end. I think we're probably getting there in terms of funders are now requiring that EDI is built into applications, so that prevents it being a last minute consideration, and you actually anticipate from the beginning where you're less likely to find the representation in the study that you're conducting. I'll just pass to anyone else.
Yeah. Niamh or Jules, do you have any thoughts on that?
Niamh, do you have any thoughts, or I can jump in?
Well, just as someone who's very recently finished their PhD, and I did try and consider as much as possible EDII principles within my PhD, but coming into BRUK and having it embedded from the very beginning and being told, this is just going to benefit the research further, being told that from a leadership perspective, like Lesley has just said, is so valuable. So that's my experience, someone quite early on in their research career.
Yeah, and I wonder, because I see this more and more now in applications, there is a distinct EDII section or EDI section in funding applications, and some of them are well considered and some less so. But actually in papers, it's still not necessary in all papers, and maybe that's something, you can't, it'd be great if people were volunteering this, but maybe there does need to be some sort of bringing it to the fore and suggesting that this is a compulsory piece of information along with your other methods. Yeah. Jules, did you want to add to that before?
I think yes. Thanks, Sharon. I think it's really good that there are some research hubs or research projects right now where EDI is actually really built on the conception of the project. But I think moving forward, we need to do a lot of auditing, or research funding organization actually really doing the auditing or feedbacking on how this actually are done in practice, because it's different from putting it in paper, but also how researchers are actually trying to apply what they've written in the application in the actual research project that they're doing. There needs to be reviews specifically done for EDI and how this being applied in research as well. In terms of analyzing data is also really important when we've seen that we're not applying the principles that we've actually talked a while ago. Yes, we can put that in our limitation, but what can we do actually in the future to refrain or limit that from happening? And I think that bit of auditing or feedbacking and reviewing and the research funders and on how this are being done is really important as well.
Great, thank you. And Sancha?
So from my viewpoint, I'll make this very brief, I guess. When you're thinking about your research team, your professional services staff like myself, we're quite important actually. So a lot of people will say to me, I used to be a researcher way back in the day, and I was a bench scientist for many years. And people used to say to me when I left, why are you going to push papers? But actually without thinking about the governance and the way that things operate, the science isn't possible. And that's the same as it's not possible to generate great science without talking to people. So your research support teams, they have a background that you might not be aware of. So speaking to them and just getting a different viewpoint of, can we do this? Can we do that? Can I do this with my money? Can I pay for someone's travel? You know, they can help you provide answers to those questions and make sure that you can get full access to all the funding that you possibly can. So just it's that same thing. Never assume that we're just pushing paper and taking minutes. There's quite a lot more to what we do and a lot more that we can help you with. And ultimately, that's the purpose of our job, is to support our research teams and to work together to generate some great research.
Great, thank you. Well said. Anne, I see you got your hand up.
Thank you. And I just wanted to reiterate how important it is at this point in time to really take responsibility for EDII in all sorts of research, because it's so easy for people to feel that it's something that's imposed on them from outside. And that's it's a point now where many companies, including in Britain, are dropping what the States calls DEI, policies and commitments. And we have to be clear about why, exactly the things we've been talking about today, why it improves our research, why it makes for much better sort of shifts in behavior, understanding of behavior, that sort of thing. In other words, to have the commitment rather than just to leave it to a formulaic policy or whatever.
Thank you. And we're at time now, I think. So thank you all for joining us today. This webinar will be, it has been recorded, and as Sancha said earlier, will be available on our website. You can sign up for our next webinar, with the details are in the chat, which is going to be on the 28th of April, Behavioural Research in Government. Okay, and thank you to all the speakers today, and I hope you all have a lovely afternoon. Thanks for attending.